Hello, I'm going to present to you today postpartum care for all new mothers, including COVID-19 information. My name is Dr. Trish Suplee. I am a nurse from Rutgers University, Camden. I'm the divisional chair of the baccalaureate nursing practice and associate professor. I am also the New Jersey A1 chair. First and foremost, congratulations on the birth of your baby. Today's presentation includes information for all new mothers who just delivered and are caring for themselves and their infants. I received any compensation for this video, but in full disclosure regarding the post-birth warning signs information, the content of this presentation is solely the responsibility of the author and does not represent the official views of A1 or Merck. In this presentation, new moms will learn about the signs and symptoms of potential complications that can occur after birth, what to do and who to contact if you think you might have any of these problems, and also what else you need to know about the COVID-19 pandemic. You probably received a lot of information to take with you after you left the hospital or birthing center. The nurses probably talked to you about many of these topics, including how to take care of yourself. And starting with self-care, I just want to stress how important it is to take care of yourself. Again, starting on the top right-hand side, I just want to go through a few of these things just to kind of remind you about what you need to look for. First of all, pain management. After you deliver, new moms do experience some cramping, also maybe some breast engorgement pain. Usually the provider will recommend some type of over-the-counter pain medicine. But if you are to need more pain medicine, or if you feel that that pain medicine isn't doing justice, please make sure you call your provider. But usually within the first day or two, this pain really does ease up. Incision or perineal pain. Your incision, whether you had an episiotomy, I'll talk about that first. That's an incision they made in your perineal area to possibly help assist with the birth process. Usually what happens is they do stitch up the incisional area, and again, we want to keep an eye on this for infection. Perineal care, they probably talk to you about using a bottle of warm water to squirt from the front to the back, and then generously just kind of patting your perineal with some toilet paper or a very soft cloth. Because again, we want to keep that area as clean as possible. The next topic is postpartum blues. Oh, I'm sorry, I forgot to talk about incision for cesarean sections. You should keep an eye on that incision daily. So again, if you notice anything such as redness, swelling, discharge from that site, or even pain around the site, you really should notify your provider. The other thing is to keep that area very dry and clean as well. And some women who might have a little bit extra padding, what you want to do is lift up that padding, make sure you clean that incision, keep it dry, and maybe even put something in like a sanitary napkin of some sort, because you don't want that area to cause a lot of sweating or to keep moisture in that area. So please make sure you're checking that incision. If you cannot see that incision, make sure you lift up the extra padding and have someone take a picture so you can see that. And I would say the same thing for the perineal care. If you're experiencing a lot of pain in your perineum rather, you want to take a picture. I know that sounds really odd in this day and age, but it might be something that you can share with your provider, especially if you're doing telehealth visits over the phone with your provider. The next one is postpartum blues versus depression. Almost about 85% of new moms experience some type of postpartum blues. And we do see this often. Again, your hormones are changing. You're trying to change into a parent. There's a lot going on in your life. So sometimes we will have moms express their ideas of what they're thinking with regards to feeling like imbalanced, I'm not a good mother maybe, and again, a lot of times this will go away, usually within about day 10. Postpartum depression, however, first of all, moms can be depressed before they even deliver. So we do start following moms for depression in the antepartum period, but we also want to really monitor new moms for postpartum depression. And this can occur within a few days to even up to the year. So again, if you're noticing signs and symptoms of depression, feeling very anxious, feeling that you just can't seem to take care of yourself or your baby, if somebody is saying to you, "Are you okay? You're not yourself," you really want to seek out some care for that. The next one is nutrition. Again, we start asking you again to be careful with what you're eating. Again, this isn't really the time to kind of say, well, I want to lose so much more weight. It's really the time to eat nutritious food because you are also trying to get back into your normal patterns. So again, eat good and also drink a lot of fluids. You do want to stay hydrated. I would recommend staying away from sugary drinks and sodas though. With regards to exercise, you don't need to start exercise patterns right away. However, walking is the best exercise you can do, and sleep is another thing. Many women will say, well, I'm not getting enough sleep, the baby's keeping me up. But at the same time, when the baby goes down for those naps, make sure you're relaxing and trying to sleep during that nap. This isn't the time to clean the house and get everything done. Give those things to other people to help you. With regards to birth control, again, this is a conversation you should have with your provider, but I do want to remind you that you can get pregnant before you get your first period. So many new moms do not look forward to hearing that they're pregnant within a few weeks after they deliver. So have this conversation with your provider. Be comfortable with regards to the methods, and there's a lot of methods that you can be utilizing. Your OBGYN follow-up, during this pandemic, many of the OBGYNs are doing telehealth visits, meaning that they're looking at you on the computer and you're looking at them. Some are actually seeing patients themselves. So what I would recommend to you is the normal time frame is usually about 4 to 6 weeks, but it's really important to stay connected. So I would even say within the first 3 weeks, have some contact with your OBGYN. Just let them know what's going on, or if there's anything going on that you're concerned of, which I'm going to go over a little bit later. With regards to primary care follow-up, if you have any medical conditions, diabetes, hypertension, was diagnosed with anything in the hospital, you really want to get connected to a primary care right away. It's really important. The other thing is when you talk about hypertension or high blood pressure, we really want to see you within about 3 to 10 days to make sure that blood pressure is back to your normal. So you might actually hear from your OBGYN that I want to see you in 3 days, or I want you to go home and do blood pressure checks. If that is the case, just make sure you understand how to do that, or that somebody that you can depend on can actually do that for you. Infant care, wow, I bet you were given a lot of information on this topic. I'm not going to go into depth into infant care, but just remember that you are a good source of information. The infant really can't tell you what's going on, so it is important to make sure the infant is feeding, the infant is stooling or having bowel movements, and also is urinating. So again, if you go through a day and that baby hasn't urinated at all, you must call your provider. It's also important to watch for fevers with the infant. Also, any types of lethargy, meaning that they're just not acting right, or they're acting a little more sleepy than they should. So again, refer back to the information that you were provided to in the hospital. Infant feeding, again, breastfeeding is the best nutrition for the baby. Some of you will choose to bottle feed, and again, there's great information on bottle feeding as well. So I'm sure you received that. Parenting is a hard job for any of you that are new parents. You know, as much as there's many books out there for parenting, it's day by day. So use your resources, use your friends who are new moms, use your providers, use your community resources, because again, there's so much out there for you that I really want to make sure you take care of all of those resources. And finally, what I want to talk about is post-birth warning signs. Now, again, I'm adding this now because it's not because it's the least amount of information you need, but sometimes it's the most important information you need, because I want to share with you what you need to do if you experience signs and symptoms, or what you should do, or who you should tell, and when you should tell them. So let me give you some background on how the tool I'm going to refer to was created. The Association of Women's Health, Obstetric and Neonatal Nurses, known as AWON, with a grant from Merck for Mothers, supported this educational program. Dr. Bingham and I led a team of nurse experts that created the educational tool, following input from focus groups of nurses who cared for women at the bedside. It was also guided by evidence we had on what potential complications or problems were leading to increasing maternal mortality and morbidity rates in the United States. The tool has been recognized by nurses, midwives, doctors, and leading maternal health organizations to be used with all new mothers. We do strongly encourage that partners and family members receive this education as well. In fact, we hope that this tool gets placed on a prominent place in your home, such as on the refrigerator, and that you take a picture of it to have on your phone. If you know of any other new mothers, please feel free to pass this information on. So this is what the tool looks like. The tool was again created by AWON. It's called the Save Your Life handout, and you probably received a copy of it before you were discharged. It has already been translated into 3 different languages, and they are working on more languages. The first thing you will see is the statement across the top, and I just want to read that to you. Most women who give birth recover without problems, but any woman can have complications after giving birth. Learning to recognize these post-birth warning signs and knowing what to do can actually save your life. You have probably heard that there has been a rise in maternal mortality in the United States, and that Black women and American Indian, Alaskan Native women are disproportionately affected, meaning they experience higher rates when compared to white women. We do not tell you this to scare you, but it is important that you and your partner are informed. We also want you to know that many of these complications can be treated if they are recognized early. That is why it is so important to learn what to look for and to tell someone. So now I'm going to break it down for you. So what we're going to do is we're going to divide this up, and I'm first going to go over POST, P-O-S-T, and this is the section where we want you to call 911 or else go to the emergency room. Now, the P stands for pain in your chest. Pain in your chest can be related to cardiac disease or heart disease. Cardiac disease is when your heart is not working as well as it should, and can include a number of disorders that may have different signs and symptoms. But some of the potential signs and symptoms we want you to look for include shortness of breath or difficulty breathing, heart palpitations or feeling like your heart is racing or beating really fast, and any type of chest pain or pressure. We want you to call 911 or go right to the emergency room. The O stands for obstructive breathing or shortness of breath. And this is related to pulmonary embolism, which could be a clot that has traveled to your lung. So signs and symptoms of a pulmonary embolism include shortness of breath at rest, meaning that you're sitting still and you still are breathing very quickly. Chest pain that worsens when coughing, or a change in your level of consciousness, meaning you're not yourself. You're not. People are noticing that you're not yourself. You may be talking a little bit differently. You definitely want to go to the nearest emergency room. And what you're seeing here is an overlap between cardiac disease and pulmonary embolism, because they both deal with chest pain or shortness of breath. So again, You don't have to know the true diagnosis, but if you feel either of those things, we want you to go right to the emergency room or call 911. S stands for seizures, and seizures are part of what we call hypertensive disorders of pregnancy or related to high blood pressure. So again, hypertension is high blood pressure. Signs of severe hypertension do include a constant headache that doesn't respond to over-the-counter pain medicine, rest, or if you have an intake of a lot of fluid. So preeclampsia and eclampsia might have been words that you heard in the hospital. Preeclampsia is a complication of pregnancy that includes high blood pressure and signs of damage to other organs. Eclampsia is the convulsive phase, or actually it's when you have a seizure. So signs and symptoms of preeclampsia include severe constant headache, changes in your vision or seeing spots or flashing lights, pain in the upper right abdominal area or almost underneath your right rib cage, swelling of your face, hands, and legs or feet, and also a change in level of consciousness. And some people actually will witness somebody having a seizure. And if you are to do that, you want to call 911, get to the emergency very quickly. And anybody with you, they want to help keep you safe. So again, by rolling you on your side while you're laying down is the safest place to be. The next one I want to talk about is we call it thoughts of hurting yourself or your infant. Now, this one goes along with postpartum depression. And postpartum depression is a type of depression that occurs after childbirth, and it can occur as early as 1 week up to 1 year after giving birth. And some of the signs of postpartum depression include thinking of hurting yourself or your baby, feeling out of control, unable to care for yourself or your baby, feeling depressed or sad most of the day, every day, having trouble sleeping or sleeping too much, having trouble bonding with your baby. And what we need you to do is we want you to go right to the hospital or tell someone that you are having these feelings so they can get you help immediately. It is really important that you be seen. Now on to birth, BIRTH, the other part of post-birth. These are things you want to call your health provider for. B stands for bleeding, soaking through one pad an hour, or blood clots the size of an egg or bigger. And again, this is related to obstetric hemorrhage when you are actually bleeding too much. It can happen after you have a vaginal delivery or a cesarean section. So again, if you're using a sanitary pad and you saturate that pad, it's really full of blood, that's a problem. You shouldn't be experiencing that. Or even if you have a handful of clots, what looks like a lot of clots in the toilet, that's not normal. You want to call someone, especially your healthcare provider, and let them know how much bleeding you are having. The next one is I, which stands for incision. And with incision, we're talking about an incision that is not healing. This can be related to your episiotomy or your perineum or even your C-section scar. So what happens is we notice that it's not healing well, meaning that it may be redness, it may be warm to touch or painful to touch. It could have a discharge of a different color, yellowish or greenish. And it also could be that it is separating, meaning that you could actually see the incision separating. I would recommend that you take a picture of it and also call your provider and let them know what you're feeling, what you're seeing. It's very important. The next one is R, and R is really related to a redness or swollen leg. And we incorporate that with venous thromboembolism. And that's when you develop a blood clot, usually in your leg and the calf area. So some of the other signs and symptoms include leg pain, a tenderness to touch or feeling like it's burning, Some women will actually see a redness of the leg. And also, sometimes you'll see a swelling of one leg larger than the other. And you definitely want to call your provider and let them know what's going on. T stands for temperature of 100.4 degrees Fahrenheit or higher, or otherwise known as greater than 38 degrees Celsius. Any type of infection can occur in the postpartum period, and that's an invasion of bacteria or viruses that enter and spread throughout your body, making you feel ill. So along with the temperature I described, you might have some bad smelling blood or discharge from your vagina. You also might have some increase in, again, the redness or discharge from your C-section or episiotomy site. Sometimes also women will actually complain of abdominal pain. So that may be related to an infection inside your uterus. So you really need to tell someone, call your provider. And then finally, the last one is headache. And this is again related to hypertension, high blood pressure, or preeclampsia. So a headache that does not get better even after taking medicine, or a bad headache with any vision changes. You don't want to wait too long on a headache because headaches really do refer to other things going on. And you want to get seen, okay? It's really important. Many women that show will say that it's the worst headache of their lives. So this is something I want you to be really aware of and to call someone. Now, one of the things not on this post-birth list is an assessment for stroke. Now, cerebral vascular accidents, otherwise known as stroke, are the third leading cause of death in the postpartum period. So again, after you deliver, up until the first 6 weeks. And although the number of strokes that occur during pregnancy is very low and after pregnancy, women are at risk due to changes in the cardiovascular system and also coagulation mechanisms during and after pregnancy. So some of the signs and symptoms depend on the location and type of stroke, but they can include a severe headache, nausea and vomiting, slurred speech, weakness of your extremities, a decrease in consciousness, confusion, and loss of balance. There is also a mnemonic device called FAST, F-A-S-T, stands for facial drooping, arm weakness on one side, speech difficulty, and the T is the reminder to get help immediately, call 911 or go to the emergency room. I just want to review those again. FAST, facial drooping, arm weakness on one side, speech difficulty, and calling 911. It is really, really important that you get those checked out. You must get medical help right away. So what do you say when you call the provider? Well, I want to tell you, when you call, say, my name is, and insert your name, and I had a baby on, give them the date. I had a baby 2 days ago. I had a baby 3 weeks ago. And I am having, for example, chest pain. I am having right calf pain and it's swollen. Be very clear with your directions, okay? Trust your instincts. Always get medical care if you are not feeling well or have questions or concerns. If someone ignores your concerns, go ahead and state, I don't think you heard me. I am very concerned about this headache I have. I would like to be seen. Have your doctor or midwife's name and number available and keep it in your phone. Know where the closest hospital is. If you do not feel that you received the response you were expecting, make sure you repeat your concerns so they're heard. You should always feel like you are being treated with respect. And please know that most of these potential complications I talked about usually occur early in the postpartum period within the first 6 weeks. However, some women have experienced them up to 1 year later. I'm going to switch gears here and talk about COVID-19 virus. It is a new type of virus that primarily affects the lungs and breathing. It is caused by a new coronavirus. The virus is transmitted by droplets, usually from sneezing, coughing, or talking by the infected person to someone else. So really it is a person-to-person contact type of virus. And that is why there's been a recommendation to stay 6 feet away from each other. People can even get it from touching surfaces or objects that they come in contact with that someone with the virus has actually touched. Most women who have delivered have been tested in the hospital where they gave birth. Some hospitals test all women, while others have tested those with signs or symptoms. All people can get the virus, regardless of age, gender, race, or ethnicity. And I want to talk to you a little bit about the primary signs and symptoms that we see. A temperature elevation, again, above 100.4 is what we talk to with pregnant women. But if you start seeing your temperature elevate, you want to call someone. Coughing, difficulty breathing, chills, muscle pain, headache, sore throat, vomiting, nausea, and loss of taste or smell. And what I want to say to you is you do not have to have all these signs and symptoms to be positive for COVID, because as we know, some people walk around with COVID-19 and don't have any signs and symptoms. But if you are to experience any of these, you really want to call your provider, tell them what you're feeling, and if you are around someone that you know has been positive for the virus, you also want to let your provider know. Symptoms may appear 2 to 14 days after you are even exposed to the virus. So what should you be aware of as a new mom after you are discharged? If you do not have COVID-19, make sure you wash your hands for 20 seconds several times a day. Avoid touching your eyes, nose, or mouth. Do not allow any additional visitors in your home. And I know this is a really difficult one, especially when you have a new baby. And also people want to come in and help you out. But go ahead and give them lists. You know, maybe they can do the shopping for you, etc. Maybe they can do the runs to the stores, but try to decrease the amount of visitors in your home. Keep alcohol-based hand sanitizer within reach in each room and in your car, and that should have about a 60% alcohol base. Wear a mask if you go out to the store or are around other people within 6 feet. Monitor your family members for signs and symptoms of COVID, like I already discussed previously. It is okay to breastfeed, and we strongly recommend you breastfeed, but just wash your hands before and after. Clean the surface areas around your house, doorknobs, cell phones, TV controls with disinfectant wipes or sprays daily. And that's something you can give to your significant other or an older child to do. Take your temperature every day and track any increase. Family members too should wash their hands before touching or holding the infant. And if any signs and symptoms are present, you need to call the provider and separate that family member who is experiencing those signs and symptoms. So what do you do if you have COVID-19? This will be very difficult to do, but it's really important. You need to separate yourself from your baby as much as possible. Babies have been diagnosed with the virus, so it is better to follow precautions that are recommended by reliable sources. We do not know for sure if a mom passes it to babe just from delivery, but those cases really haven't been reported. And we also know that we're not quite sure about breastfeeding. So we still do recommend breastfeeding as a viable source, but we want to discuss with you some precautions. First of all, make sure your provider is aware. That's one of the first things you really have to make sure. You also need to make sure that the pediatrician is aware, because the pediatrician or the baby doctor may actually want to culture the baby with a swab inside the baby's mouth. Monitor your temperature every 4 hours and take medicine to reduce your fever as directed. Stay in a separate room with a bathroom whenever possible. And I know this is really hard because some people, they don't have that option. So again, try to keep separated as much as possible. And in the company of others, you should definitely be wearing a mask, and they should also be. Try not to touch or hold your baby as much as possible. Ooh, is that hard? Have your partner who is non-infected care for the baby as much as possible. Try to maintain a 6 feet distance. Talk to your provider about breastfeeding. Both of you should kind of come up with a plan so you're both on the same page. If you are breastfeeding, change your top, don a mask, put a mask on, wash your hands, and then breastfeed. And then after you breastfeed, you want to wash your hands again. You can pump your breast and have your partner feed the baby as well. Remember to do the same steps, but also you need to clean the pump before and after. You want to maintain communication with your provider and the pediatrician. You can also have your significant other feed that baby with a bottle of your breast milk. What we do want to recommend, however, is that if you experience difficult breathing, constant pain or pressure in the chest, a new confusion or bluish lips or face, you really need to go to the emergency room. And you can call ahead, but it's really important that you get seen. Some people that have COVID-19 do very well, and others have not done so well. So again, we want you to be safe, but we also want you to get the care that you will be needing if you have COVID. So when can I have more contact with my baby and be reunited if I have had COVID? Well, what we are looking at right now is that you are afebrile or you don't have a fever for 72 hours without using any type of medicines. And other symptoms have improved. And also at least 7 days have passed since symptoms first appeared. Now, some people are recommending 10 days. So again, you need to talk to your provider about how they feel about that number of days. But you are going to have to try to separate yourself from your baby as much as possible. These are some links for you. COVID-19 information changes very frequently. At one point, they were changing daily, and now they're changing as we get more information, as we collect more data, as we do more research. But these are some great sites for you to visit. The CDC site for breastfeeding is there. ACOG is basically, like I discussed about A1 being our nursing organization. ACOG is actually the obstetric and gynecological source that we use a lot. So that's a great resource for you. For infant care with moms who are positive, the American Academy of Pediatrics has some wonderful information for you, as well as caring for your baby. Here are some additional references focusing on postpartum complications and information about COVID. All of the information about COVID on this presentation is from the CDC and the Academy of Pediatrics. If you are seeking more information, I would recommend visiting these sites. Regardless of what is going on around us, you are a mother with a voice that deserves to be heard. I wish you well, and please know there are so many resources for you. Reach out to friends, family members, and community resources. This is an extremely, extremely special time, and I want you to enjoy the experience.